Thin endometrium is a nightmare basically for an IVF specialist and a patient, because for a proper embryo transfer we need to have a proper endometrial lining. So the optimal thing is something around 9 to 11 mm, but obviously the transfers can be done after 6 mm. But what happens in many patients, the endometrial lining, we have to see the endometrial lining, the thickness doesn't come, so we call it as a thin endometrium, or the thickness comes but there is no blood supply, or the volume is less. So these are all the parameters that we face as a challenge during our embryo transfer, and we have to overcome it to give good success rate. So coming to the causes of thin endometrium. So what causes a thin endometrium? So basically, foremost, obviously any layman also will come to know that obviously if they are having thin endometrium, they are having some hormonal imbalance in their body. Secondly, there might be some anomaly, some problems there in the uterine area. So that might be the cause of the thin endometrium. Maybe you are having some adhesions inside or any other problem. So first and foremost, to come to a proper diagnosis, we need to be very particular that okay, you are in the category of thin endometrium. It's not like by chance in this cycle, maybe many times what happens, the patient has not bled properly, or they have been taking some medications, they were having some fever, they were having some other problem, and in that cycle the patient tries to get the endometrium prepared, and then a thin endometrium comes. So in that case we give the benefit of doubt to the patient and we skip that cycle always. We don't label the patient as a patient with thin endometrium, and in the next cycle then we go for 3D scans, we study the endometrial layer, we study the thickness, we study the volume, we study the Doppler, the blood supply. So if any problems comes there, we have to rectify it. We do a hysteroscopy. If there is any problem, obviously we do the adhesive lysis in hysteroscopy. Secondly, there is a thing called uterine PRP and stem cell processes. So we do all this clubbed with the hysteroscopy to have good results. And there have been wonderful results in thin endometrium patients with uterine PRP, or when we are giving this growth hormones also. So these are some of the things that we do to increase the endometrial lining layer and to have good success rate. And there are patients who after taking these treatments have had good success rates. Plus there are many adjuvant treatments also. We give vaginal tablets, we give other antioxidants also, which increasing the endometrium lining. But it's always safe, it's always better for the patient and for the patient also. Don't pester your doctor to do the transfer if the doctor wants to cancel the cycle, because if the doctor is cancelling the cycle for thin endometrium or any other endometrial problem, definitely there is some problem and it is for your benefit. Might be you're suffering from some infection, the doctor will rule that out for you, so you are having this problem, or you might be having any other problem. So let it be diagnosed and then only go for the transfer. We care about you.